One of the biggest concerns of those heading into retirement is the increasing cost of health care. So what does Medicare cover and what does it not cover? That is the subject of this video. Welcome to another episode of the Financial Fast Lane. My name is Lane Martinsen. I am a financial planning practitioner. I am the author of the Holistic Retirement Planning Revolution. And on this channel, we discuss retirement planning topics, specifically for those aged 50 and over. Now, healthcare is a big concern on many of those preparing for retirement and those already in retirement. And so what does Medicare cover and what does it not cover? Today, I have a special guest, Keith Armbrecht. He actually has a very popular YouTube channel where he specializes in and talks about all the ins and outs and the details of Medicare. And he can really provide some good education. So we're going to talk with him today, and I'm going to connect with him through Zoom right now. So I've got Keith Armbrecht here from Medicare on Video. Keith, how are you doing today?
I'm great, Lane. Thanks for having me.
All right, so what can you tell us? What are some of the key things that Medicare does not cover? What are some important things that we should know?
Well, I obviously deal with people every day that are getting ready to start their Medicare, whether they're turning 65 or whether they're about to retire and they're already past 65. It's time to come into Medicare. So there's a lot of choices, a lot of decisions to be made. And then sometimes there are surprises. And some of the surprises are things that Medicare does not cover. So I'm going to kind of go over that right now. 5 of the big things that sometimes people think are covered, but generally are not covered under Medicare. And just it's important to understand things when you're coming in. And as we go, I also have a book that I cover just about every piece of Medicare, and I'll show you where to get that as we go as well, where you can download it for free. Has videos in it, has all the links you need, and really helps people get to where they need to be to understand what their choices are. So when we talk about things that Medicare doesn't cover, when we talk about Medicare, the first part to understand is what is Medicare. And we're talking about original Medicare, Medicare Part A and Medicare Part B. That's kind of the foundation of Medicare. And it's actually very good coverage. It's usually better than what people have had at work their entire lives when they come into Medicare. It covers very well, and it pretty much does what it's supposed to do. But there are some things to understand about it and some of the pieces where it doesn't cover. And really the first one, that we understand where it doesn't cover is routine dental care. And that surprises a lot of people because generally, if you've worked at a company and you've had group health insurance, you've probably had group dental insurance as well. So when you come off of your group coverage and go into Medicare, dental's a big deal. And it's something you need to understand. And where Medicare covers would be something that would be medically necessary, generally like in an accident. So if you were in a car accident and you broke your jaw or something like that, that's where Medicare would cover under medical necessity, where routine dental care, stuff that we all do, checkups, cavities, gum work, dentures, things like that, Medicare does not cover. So it's something to understand coming in. Now, there are supplemental plans that do cover it. So there are senior dental plans that you can have as part of it. So it's something that can be done, but it's just not part of regular Medicare. The next one is vision care, and that surprises a lot of people as well. So it does not cover routine vision. It does cover, again, medically necessary things. So Medicare does cover stuff like cataract surgery, and it covers, significant stuff like glaucoma and things of that nature, but it does not cover contacts, frames, vision exams, lenses, and things of that nature. So generally, you will get that together with a standalone dental, vision, and hearing plan. They kind of combine dental, vision, and hearing. That'd be another piece of this where Medicare doesn't cover hearing aids. So you generally will have a plan outside of Medicare and it's not terribly expensive. And there's a couple of different avenues, but a regular PPO type plan for someone 65 and above is generally about $50 a month. So there are some different caveats to it to understand, but that's what we do is we help figure out what the right plan in the right zip code is. And we can certainly help anybody that's coming into Medicare figure out that kind of stuff.
Great.
Does that make sense to you?
Yeah, it does. And so we're not talking about Plan C at all. That's a whole, Medicare Advantage is a whole different deal, right?
Yeah, Medicare Advantage is outside of original Medicare. So that's a whole other conversation where, I mean, that's a main choice when you come into Medicare is whether you stay on original Medicare or whether you go on to a Medicare Advantage plan. And there's some big differences in that choice that you want to make sure you understand before you make that choice. Because sometimes things sound absolutely terrific, but once you get inside of it and start to use it, it can be a little bit different. So some of the other stuff that Medicare A and B, original Medicare, does not cover, and this kind of surprises people, but you've generally heard about it, is prescription drugs. So Medicare itself does not cover prescription drugs, but there are Medicare drug plans. And Medicare drug plans are a little more complicated than the rest of Medicare. So it's important to figure it out based on really current medication. So Medicare drug plans can differ greatly on how they cover certain prescriptions, whether they're on tier 1 or tier 2 or generic or formulary, whatever it may be, and how big the deductible is, how big the coinsurance is. It can be a mess. And it's something that a lot of times people get sold into and they don't really understand it. And when you get a Medicare drug plan, you're kind of locked in for a year. So you can change it at the end of a year. But while you're in it, you just want to make sure that based on what you currently take, that it's the best plan to cover those kind of drugs. So prescription drugs is certainly a big one. And again, they're standalone private insurance company drug plans. And again, this is with original Medicare, not Medicare Advantage plan. Sometimes a Medicare Advantage plan may include a Medicare drug plan as part of their package. But again, it might not match up with the drugs that you currently take. So it's super important to figure that out based on current medications. Mm-hmm. Right. Another thing that people sometimes are confused with is long-term care. And long-term care is obviously a complicated conversation where, you know, when should you have long-term care coverage? Do you need long-term care coverage? Can you just spend down your assets and then you'll be covered under Medicaid scenarios? Again, it's a little complicated, but Medicare itself covers pretty much rehab services in nursing facilities. So they cover up to 100 days if you have a Medicare supplement plan that goes along with it, but it is not intended for long-term care. So long-term care, it's complicated because it's so expensive. To buy a long-term care insurance policy, it's a lot of times cost prohibitive. So it's difficult unless you bought it in your 50s. If you're looking at it in your mid 60s or later, it really is going to be a tough decision. So certainly something kind of to understand and talk about. But people have questions on that all the time as well. And again, it's an optional private insurance type plan. If you do purchase a long-term care plan, it's run through a private insurance company. And then the last thing we have, which is really important, and people don't think about it coming into Medicare, is foreign travel coverage. So if you're traveling outside of the United States, Medicare isn't there. And Medicare doesn't cover if you're in Mexico or Europe or Germany, wherever you may be. It does not cover you while you're out of the country. And most Medicare Advantage plans also do not cover you while you're out of the country. And most people generally, when they retire, are planning on traveling. And some travel internationally, some don't. But, a lot of times they do. So you can either pick up a private insurance plan, which can also be complicated for out of the country coverage to make sure that it's going to do what it's supposed to do. Or when you have original Medicare, a Medicare supplement plan does cover foreign travel emergency coverage. So there's coverage under a Medicare supplement plan. And that's, one of the big differences between original Medicare and Medicare Advantage is original Medicare, you don't have any networks. So you can go to any doctor, any hospital, anywhere in the country. If you have a Medicare supplement with it, it'll cover you outside of the country. With a Medicare Advantage plan, it works more like an HMO type environment where you have to go to certain doctors, have to go to certain hospitals, and it keeps you in network for things that you want to do. So it can be restrictive. And if something catastrophic comes along, it can be a big deal on having choice of where you want to go. So, but again, that's stuff we help with all day. And, the great thing is there's no cost for people to let us help them. So it's actually a pretty nice thing to be able to help people, and there's no cost on their side to do that. And like I had said in the beginning, I have a book if you want the book, and it really covers all the topics, and I've written it to make it easy to kind of understand things. And it has links to the videos right in it. It has links to where you sign up for things right in it. So it's very easy to do. If you go to medicareonvideo.com/free book, you'll download it immediately, and you can keep it on your laptop or your computer. And it's a good resource to have going forward. So that's kind of an overview of some of the bigger things that Medicare doesn't cover, but happy to talk about any of the questions with anybody that's facing that challenge.
Yeah. Well, thank you, Keith. I know it's a big subject, and this is a fairly short video, right? But I will have a link below in the description where you can visit Medicare on Video and access the wealth of information about Medicare. And Keith is available to answer questions as well when you contact him.
And I think I'm over 150 videos on my YouTube channel. So just about any piece that you need, you can find pretty clean explanation right on Medicare on Video YouTube.
Well, thank you. Thank you for being a great resource, and I appreciate you coming on the Financial Fast Lane today. And so we will look forward to talking to you again in the future.
That's great. I thank you for having me, and have a great day.
Okay. Thank you, Keith.
Thanks, Lane.
All right. Bye-bye.